If I could just really quickly add that I go through this all the time with biotech clients. It's something that everyone's understandably concerned about. Unless there is a knowledge of adverse effects or a good reason why the drug definitely should not be used off-label, the standard messaging around that is the drug is indicated for XYZ, and that's what the label says. Ultimately, prescribing decisions are left up between a patient and his or her doctor.
I think we would look at whether or not the doctor who's prescribing the drug off-label has a relationship with the pharmaceutical company. So if that doctor is on the speakers bureau of the company, whose drug he's prescribing off-label, then that would be an issue.
And I'd also mention that this became particularly pernicious during the tech boom, when you had a lot of Wall Street analysts showing up at the science meetings, looking for the hot new studies that were being unleashed by a company, and you'd see some promising study would come out, the analysts would write it up, the stock price would go up, and then there would be some media coverage of it. And companies got the idea that this was a way of, there's a way of using clinical studies in the journals in order to sort of expand the market for your drug, and to what extent that can catch up with you if you end up having adverse effects later on. That's something that companies got to keep in mind. But when that's out there, and you've got Wall Street writing about it, and you've got the medical journals writing about it, and it's driving the stock of your company, media, like the business and general media, is going to be writing about it.
I can tell you from a PR perspective, this does come up quite a bit. And I think Deborah and Mark and Gerri hit it right on the head, in that the company, the pharmaceutical company behind the drug, it cannot go out and promote off-label use. But the individual physicians who use it as they see fit, that's a different story.
The question I was asking had to do with managing this story. If it gets out from the company's perspective, people go to the company, and I think he answered the question.
Right. Any other questions? Let's go ahead right here.
This is not a political question, but it sort of has implications that way. That in a lot of the layman's press, with the wow factor, it creates expectations in the public that a lot of this technology is going to be available to them. But the reality is there's never going to be reimbursement for it. And how do you guys look at that? I mean, especially now, with our insurance fees going up so high that very soon most companies in California will switch to HMO plans, and this stuff is not going to be in the formularies. So are you guys even aware of that horizon?
There's the New York Times recently did an article about a doctor or a surgeon who could do these, remove cancer through these like marathon surgeries, these 23-hour surgeries. Did you see that? And I realize that that's not practical for most, for anybody except for that one patient who he decided to work on. I would still do the story. Because, it's just like science fiction. Sometimes it really does become reality. I think sometimes it's valuable to know what's possible, even if you can't afford it, to just know the possibility. Because maybe that can be carried forward.Maybe the price will eventually come down. And to just know what's possible is valuable.
And also in the reporting and in the preparation of the story, you bring in the pertinent facts. And the pertinent facts are, this is a wonderful thing, but it is going to be very costly, or it is not going to be available, or whatever, it's not going to be available for a while. I know that the medical department of, at least that newspaper, the New York Times, they're very leery of having stuff appear in the New York Times. That somebody is working on a drug for Alzheimer's, because they're wary of the readers saying, hey, did you know they have a drug for Alzheimer's? And it's right there, I read it in the New York Times, or I heard it on Fox News. Come on, you got to deal with the public.
But by the way, if there is a drug that's on the verge of curing Alzheimer's or cancer or anything else, and it looks promising, and yet reimbursement is an issue, these 4 people potentially have the ability to change that. They have the ability to create or perpetuate public sentiment that will make it reimbursable.
That's called the power of the press. I've been in the press for a long time. I don't fully believe in it.
Any other questions?
That's what Hearst did with the Spanish American War.
Well, you know, there was an old expression, never make enemies with anyone who buys ink by the barrel, but I guess now would be bandwidth by the, you know, something or other. Any other questions? Right here.
Can you just sum it up, and as far as any experiences you've had where you're reporting, especially for smaller companies, how you've impacted like their future? Any just case stories that you have?
I can tell you that we did a story, not on a company, but on a couple of individual doctors. We did a story called Dr. Clean a couple of years ago, and it was about it's an epidemiologist at a small hospital in Long Beach who his job was infection control. So every patient admitted to that hospital got their fingernails cleaned, their nose was swabbed for MRSA. He dropped his hospital-acquired infection rate to near nothing. He had 2 years with no MRSA infection in his hospital, so we did a story about him. He then got job offers to, you know, run infection control at hospitals all over. More recently, a story about PCOS, which is a polycystic ovary syndrome. The physician who was heading up the research program at Cedars-Sinai Medical Center, which is already a big institution, but he's now being considered for the presidency of, I don't know, a medical college in Georgia, the presidency. And what is he sending? He's sending the story that we did. Now, he has a body of work, you know, behind him and a body of research, but apparently he thinks it's important to influence their decision to send the story, you know, the TV story. So, you know, as long as people know your name, it can be a good thing.
Well, we're also very judicious about what goes on the air, so I would say if you do get on the business hour, you'll probably get a good response, and frequently we do hear from whatever company CEO or spokesman for various companies who have come back to me by email or through phone calls saying that they received a tremendous response from being on the show. And you know, I say that, you know, the Dead Sea is dead because it has no outlet. It's certainly very important to have an outlet here in this town, and if not, perhaps create your own outlet. And given the specialization of your field, it does make sense, I think, in this new media environment to perhaps create your own media situations, create your own websites where you perhaps are presented on video or even on audio, and create your own situation for people who are really very interested in finding out what you're doing at your company or in your particular field. So that would be one suggestion. The other suggestion would be to, again, being the fact that we're very news driven, to latch on to a story if there's something about stem cell research and your local company has some connection to that. I would be interested in hearing from you, or brain cancer and so forth. I myself am connected to the Concern Foundation for Cancer Research, which every 2 years brings in researchers from around the world to consider various grant proposals. Anything that shows promise in curing cancer is then funded through the fundraising efforts of that organization. So I'm very interested in what you do.
I was just going to answer your question. It's very indirect. Yeah, I know a lot of things I have done over the years have had an effect, but in many cases, you never hear back directly, but you do know, and then you do hear that something you wrote went to somebody else, and then they acted in another way. Yeah, come on, it's the public domain. That's the legal name of it, anyway.
Yeah, and I'll mention the same thing. I can't come up with the same kind of stories that Gerri does, but you know, I'll hear back that they got a lot of calls after a story. I don't know that I've ever recalled a case where some company suddenly had an angel investor come out of nowhere saying, I read about your great company, and you know, here's $1.5 million. But that's, you know, if you ever have that happen to you because of one of my stories, be sure to let me know, because that would be a nice example to share with folks.